फिर से. Hello people, myself Tulsi Sinha and I am from 17 batch. Today I will teach you about emphysema. Let me first start with the gist knowledge. Emphysema, what is emphysema? In a short, emphysema is it's a type of chronic obstructive pulmonary disease, COPD. It's actually a type of a chronic obstructive pulmonary disease. Here it's like mainly the air sacs in this emphysema, mainly the air sacs, that is the air sacs in the lungs. The air sacs in the lungs, they become damaged with the damaged air sacs, damaged and stretched. For example, like in a shot, like this is a lung, there are two lungs. The here air sacs, like this is the alveoli forming the air sacs. There are millions of air sacs present that helps in the transfer of gases of CO2 and O2. This air sacs gets damaged and stretched, which results into chronic cough. That's a chronic cough and difficulty in breathing. Chronic cough and difficulty in breathing. This is the main reason. This is actually the gist of emphysema. It's a type of COPD in which, that is chronic obstructive pulmonary disease. Here mainly the air sacs in the lungs, they get damaged and stretched and hence results into chronic cough and difficulty in breathing. There are various causes. The common cause is smoking. Smoking is one of the common cause, and it can also be genetic. Like we can also keep one of the factor as genetic factor. This is actually the normal gist of emphysema. Okay. Now let's come to the type of emphysema. These are the types of emphysema. Let me tell you the types. Okay, I'm sorry. Okay, the types of, like, normally the emphysema in a normal the lungs, the fibers are like. Now we come to the types of emphysema. There are in normal there are 4 types of emphysema. There's centra-acinar emphysema, that's pana-acinar emphysema, then it is a irregular emphysema and a paraseptal emphysema. Centra-acinar emphysema, in a normal emphysema you will find a terminal bronchiole, you will find a respiratory bronchiole, an alveolar ductal and a alveolus, which is a normal. And in the centra-acinar emphysema, that is central lobular, here the lobule is present in the central part. It mainly affects the central or the proximal of acini and spares the distal part. It spares the distal part and mainly involves the the central part. It's predominantly seen in a very heavy smokers. The people who smoke a lot, it is heavy smokers, it is found, and mainly associated with the chronic bronchitis. This may coexist with coal workers, like causing pneumoconiosis and all. Then peribronchial and bronchial species that commonly shows inflammation. There are presence of inflammation in the peribronchial and bronchial spaces and in the lungs. Then we come to the pana-acinar emphysema. This is uniformly enlarged. This pana-acinar emphysema is uniformly enlarged. The level of respiratory bronchiole is the terminal, that is ranging from the level of respiratory bronchiole to the terminal blind alveolar sac. This is in this direction, from the level of respiratory bronchiole to the terminal. Okay, it is associated with alpha-1 antitrypsin deficiency. Here mainly it was associated with the heavy smokers. Okay. Now, like in a paraseptal distal acinar, I am just telling you, in a distal part of acinus involved, proximal part is normal. In a paraseptal, let me talk about the paraseptal one. Paraseptal distal. Yes, we were talking about paraseptal distal part. The paraseptal one, that is the distal acinar. Okay, the distal acinar, here the distal part, the name shows the distal part is involved. And the proximal part is normal. Then along with the pleura, it is along the pleura and perilobular septum. perilobular septae. Upper part of lungs, as the distal part is involved, usually seen in the upper part of the lungs. Upper part of lungs is actually observed, and mainly it has a the common complications include spontaneous pneumothorax. The spontaneous pneumothorax is one of the common complications. Now we come to the irregular one, this one. The irregular, that is paracicatricial emphysema. Paracicatricial emphysema, it is an irregular involvement of SMS. In the normal sense, it's an irregular involvement. Actually irregular involvement. And it is asymptomatic and clinically significant. It's a totally asymptomatic. Irregular ones are totally asymptomatic and it is clinically insignificant. Now we come to the other types of emphysema, that is the compensatory emphysema. In this compensatory emphysema, there is a dilation of alveoli without destruction of the septal walls. Here, first point is dilation of alveoli. Just a paper is there. Dilation of alveoli without the destruction of septal walls. It is mainly due to loss or removal of lung substance anywhere. It's mean compensation. That just compensates the emphysema. It's mainly response of the loss or removal of the lung substance elsewhere. Now we come to the obstructive emphysema. It's the expansion of lung because of air trapped in it, mainly the inflation, overinflation. That is air trapping. The air gets trapped in it. It's mainly of two types, like you can come across the two types, that is subtotal obstruction and a total obstruction. In a subtotal obstruction and a total obstruction. In subtotal obstruction, this one, air enters in inspiration but cannot exit in expiration. It enters but cannot exit. Whereas in total, ventilation collaterals. Ventilation is of both the sides. Now we come to the bullous emphysema. In the bullous emphysema, it's a form of emphysema this is the large subpleural bullae. Mainly to the large subpleural bullae, and mainly the size of the bleps are more than 1 centimeter in size. Rupture may lead to pneumothorax. Here the rupture, if this bleps get ruptured, this may lead to pneumothorax. And pneumothorax is dangerous. Now we come across the interstitial emphysema. The interstitial emphysema, it is very simple. Air entry into a connective tissue through lungs, that is mediastinum and subcutaneous tissue, it enters. There are various causes that include like bronchial obstruction, that is one of the causes, bronchial obstruction. Bronchial obstruction, one of the causes, mainly due to the explosive coughing, that too explosive, like it's too dangerous. In this case, mainly the interstitial emphysema. Here the puncture of the lung on the chest, on the rib, can lead to interstitial emphysema. Mainly the puncture of the lungs or the chest, that is mainly to the fractured rib, can lead to this fractured interstitial emphysema. Now we come across the pathogenesis. The pathogenesis of emphysema. Let's remember in the form of a pneumonic. Like we mainly come across the pneumonic paranasal sinuses. Like it's a normal word we mainly came across. Paranasal sinuses, from this you get a, I must say that we can get a idea in exams mainly. We can be like protease, antiprotease mechanism stands for P. Role of neutrophils, N stands for nasal, and smoking, sinuses. Like I remember this way. You can make your own mnemonics as well. Pathogenesis mainly include the protease, antiprotease mechanism, the role of neutrophils, and the role of smoking. First we will in a short for the role of smoking and the role of neutrophils. I will tell you for the role of neutrophils. Role of neutrophils, I will again give a mnemonic. ECMO. ECMO is actually a company. Like I never knew this in India, but it's a company. ECMO mainly is elastase activity, cellular proteases, matrix, the one is a big word, matrix metalloproteinases. matrix metalloproteinases, cellular proteases, elastase activity, and oxygen derived free radicals. It's an oxygen derived free radicals. Okay, done. It's a short for a role of neutrophils. ECMs, elastase activity, cellular proteases, and matrix metalloproteinases, and oxygen derived free, and the role of smoking. Smoking is, as well, we can say that smoking enhances the elastase activity of the macrophages. Like it just increases the elastase activity of macrophages. Elastase activity for the macrophages and macrophage activity is not inhibited by alpha 1 antitrypsin, and it can digest it later. Like it is digested later. So this is for smoking, and now we come across the protein antiproteases. So this is for smoking, and now we come across the protein antiproteases mechanism. In protein antiproteases mechanism, it's mainly the homozygous patients which are having a genetic deficiency of alpha 1 antitrypsin. They have an increased tendency to develop emphysema, and smoking, it exaggerates. Smoking actually increases emphysema. Then normal alpha 1 phenotype is PIMN. It's a normal one. It's alpha 1 normal is PIMN, and the type is a phenotype 1. Phenotype, it is PIZZ. In short, this is what. So this was the pathogenesis. First remember it as PNS. First remember it as PNS. There is protease, antiprotease mechanism, role of neutrophils, and role of smoking. And finally, in the form of this is for the enhancers. This is for the enhancers smoking. This is for the neutrophils that enhances, and this is for the protease, antiprotease mechanisms. Now we come across the clinical features of emphysema. Now the clinical features of emphysema, like here, mainly the clinical features are observed when the 1/3 of the functional parenchyma gets damaged. Of the functional parenchyma, it gets damaged, and then the patient starts showing the clinical features for emphysema. Various features, like first is dyspnea. In dyspnea, like mainly people gets up at night. It's a symptom I will tell you later, like it's a surgery part, it will be explained. Dyspnea, cough with sputum. Main is it comes late, but with sputum too. Severe weight loss. There will be a severe weight loss. In emphysemic patient, you will see a severe weight loss. Prolonged expiration. And one is like a key to diagnosis is prolonged expiration. It takes a long time to expire. The breath. Death, main cause of death, I will say. This is the key. Main cause of death. Death may be due to, let's remember it as RRM. Respiratory acidosis. And coma. So coma is, and right-sided heart failure, and our M stands for massive collapse of lung. This is mainly secondary to pneumothorax. That's all for emphysema, and it's done.